Hello, I'm Anna Hudzik, and today we're going to be talking about iron-rich and fortified foods in combating IDA. The research topic I chose was how do iron-rich and iron-fortified foods help in combating iron deficiency anemia. First, let's start by learning about what iron deficiency anemia is. Iron deficiency anemia, commonly known as IDA, is a common condition when the body doesn't have enough iron to make hemoglobin. Therefore, your blood produces a lower than normal amount of healthy red blood cells. Most common symptoms include weakness, pale skin, chest pain, extreme fatigue, headaches, and cold hands and feet. So, what exactly causes IDA? If you're not consuming enough iron or your body is losing too much of it, your body is then unable to produce enough hemoglobin and will eventually lead to the development of iron deficiency anemia. IDA has a number of causes, but the most common are inadequate iron intake and or blood loss. Other causes of IDA are pregnancy, an inability to absorb iron, genetics, and cancer. Did you know that over 1.2 billion people are affected by IDA worldwide? With over 30% of the population suffering from IDA, it is one of the most common nutritional deficiencies in the world as of today. So, who's got risk? Risk factors include gender and body type, leaving women most vulnerable, especially those who are pregnant or breastfeeding. Diet, especially one with low iron or lacking iron rich foods, can lead to deficiency. Age also plays a role as children under 5 years are likely to develop IDA due to an overconsumption of cow's milk, an insufficient diet, and being prematurely born. Genetics can also play a role if there are mutations present in the TMPRSS6 gene. And lastly, blood loss from menstruation, pregnancy, and even childbirth can put you at risk for developing IDA. How do we diagnose IDA? Iron deficiency anemia is diagnosed through blood tests, which include a complete blood count. Through these tests, someone who is anemic from iron deficiency usually include the following below. At the bottom, I've included a table that shows the normal hematocrit and hemoglobin ranges for both men and women. Now let's move on to discuss iron-rich versus iron-fortified foods. Iron-rich foods that consist of heme iron are foods that contain higher levels of iron, which are most likely absorbed by the body. Some examples are meat and animal products such as turkey, beef, chicken, lamb, pork, and liver. Iron-fortified foods, on the other hand, include non-heme iron that was added to food to improve nutritional and health benefits. Examples are breakfast cereals fortified in iron, tofu, beans, lentils, and peanuts. Now let's dive into our case study, iron deficiency and the role of iron fortification in food. The goal of this study was to see the effectiveness of certain diets and dietary strategies, more specifically of iron-rich and iron-fortified foods, in helping improve iron levels and combating iron deficiency anemia. The study reviews randomized controlled trials and observational studies on dietary iron interventions, assessing outcomes related to iron and iron status. This includes hemoglobin levels and anemia. Iron fortification interventions are as follows. 1. Iron supplements, capsules for severe deficiencies. 2. There's biofortification, which is breeding crops to enhance intrinsic iron content. And then 3. Food fortification, which is adding iron to packaged food at the manufacturing stage. This table on the right was included in the case study, and it helps identify the best iron compound for a specific food fortification by balancing solubility, bioavailability, sensory impact, and cost. It shows the complexity of iron fortification strategies and the importance of selecting the correct compound for effective food products. In conclusion, the study finds that certain diets and dietary strategies related to iron consumption and consumption of iron-rich and iron-fortified foods can lead to effectively improving iron status and reducing the risk of iron deficiency anemia. So how are they connected, you may ask? That's through prevention and treatment. You can reduce your risk of developing iron deficiency anemia through adapting a diet high in iron or incorporating more iron into your day-to-day routine. Some iron-rich food options include red meat, pork, poultry, seafood including shellfish, beans, dark green vegetables, and spinach. And I want everyone to say hello to vitamin C because did you know that iron boosters such as vitamin C help to increase your body's ability to absorb iron? How is this possible, you may ask? Vitamin C is able to create a more acidic environment inside the stomach, which helps prevent the oxidation of ferrous iron to ferric iron. Sources of vitamin C include tomatoes, any kind of citrus fruit, peppers, including red, green, any color, you name it, and broccoli. How much iron do you need? If you look at this chart here, your recommended daily intake of iron varies slightly based on your age group and, as you can see, gender as well. Take a second to pause the video if you'd like to see how much iron is recommended for you. Now, in order to improve our diets and combat IDA, the best diet should include foods high in iron, both iron rich and iron fortified. It's important to also be aware of foods that can inhibit iron absorption. Now, let's go through what a diet may look like for someone trying to increase their iron. For breakfast, you can start with unsweetened oatmeal topped with raspberries or seeds and an iron fortified glass of orange juice. Maybe try to avoid tea and coffee as those inhibit iron absorption. On to lunch, you can have a bowl of beef chili or a tuna burger with a vegetable or legume side of spinach, beans, or peas. An alternative may be a bagel with smoked salmon, cream cheese, and spinach. And then on to dinner. Lamb chops with boiled baked potatoes, steamed broccoli, and curly kale always sound like a good option. And if you're always looking for some snacks that are high in iron, they're pumpkin seeds, raisins, strawberries, broccoli, almonds, and cashews. In conclusion, a diet that incorporates both iron rich and iron fortified foods is essential for both preventing and treating iron deficiency anemia. Education on proper dietary practices, including pairing iron rich food with absorption enhancers like vitamin C, is vital to combat the global issue of iron deficiency anemia.